A popular brand of snack crackers is under a national recall this morning. Studies show type 2 diabetics may be under more financial stress than most people, and there are some new vape products flooding the market with some flashy gimmicks. WWL Louisiana Chief Medical Correspondent Dr. Hebert joining us now to discuss these health headlines. You know, every time we turn around, there's like a recall on something we eat or use every single day.
And this one is pretty bad. And the reason why, it's Ritz crackers, right? Everybody loves Ritz crackers, but the recall is because some of the cheese crackers are labeled as peanut butter crackers and vice versa. What does that mean? That means if you're allergic to peanuts and you're thinking that you're getting a cheese cracker, then you could have a very serious health issue because you can have anaphylaxis as well as just some regular non-life-threatening allergy issues with that. Okay, so we're going to make sure on the website you're going to see the lot numbers of those Ritz crackers, and just be careful, because besides just tasting totally gross, if you're expecting peanut butter and getting cheese, it's a lot more serious than that.
That can be really damaging.
Absolutely.
All right, so let's move to diabetics facing more financial stress. What is the big factor here?
Yeah, and it just like it's, you know, it couldn't get any worse for diabetics, right? I mean, we know we got the Fit for Duty program out there. We want you to really be trying to do that and lose some weight. But JAMA, the Journal of the American Medical Association, showed that if you have diabetes, you are at risk for significant financial stress. That increases if you are female, if you are below the age of 65, and you have another concurrent illness. But what it basically showed is that when you get diabetes, then that means that you are having a lot more financial stress because you're having to buy a lot of stuff, and you also are sometimes having mental issues because you're depressed about your weight gain or weight loss, possibly, as well as just the whole concept of being diagnosed with a chronic disease. Now, one thing I want to also let people know, if you, and listen up really well, if you get diagnosed with diabetes and you can lose about 10 to 15% of your body weight in the first 6 months of diagnosis, then you have a really good chance of getting rid of the diabetes 100%. And that was a study that was done about 2 years ago. So I stress this: if you got diagnosed or just recently diagnosed, please make sure lose the weight immediately.
What about the people who feel that they just can't do it, that that's unobtainable?
Yeah, well, then you can get your primary care doctor to write you a referral to a dietitian, and I think that's a really important thing, so you can get your food under control. You gotta decrease your intake and start working out and just getting busy, and that's what's most important.
All right, so let's talk about vaping. We've seen so many different new innovations on the market.
This is bad, and all the parents out there, school's about to start. I'm telling you, this is almost an emergency for me. And the reason why is because you may not think that your child is vaping, but you may have bought the vape, because right now we're seeing an influx of these vape products from China. They're being disguised as headphones, book bags, sunglass cases, smartphone cases, highlighters, video game cases, all these things, and there's a vape in it. We sold 240 million vapes last year in the United States, and most of them to teenagers and young adults. And I'm telling you right now, your children are out there, they're vaping at school, and they're having problems with that because they're using marijuana or nicotine in that. And so just because it's not marijuana, which could kill them, obviously, because it could be tainted with fentanyl, but also the nicotine. Some of these vape packs have the equivalent of 35 packs of cigarettes in one vape pack. That's how much nicotine can be in one of these vape packs. So you don't want your child to be addicted to nicotine, and you also don't want them to get some tainted marijuana out of the vape pack that could be tainted with fentanyl. So, because they could die. So what you got to recognize, folks, is that you've got to pay a lot more attention to your kids, because I never thought in a million years that I'd have 10-year-olds, 11-year-olds, 12-year-olds coming to the hospital because they are being taking vapes at school and passing out, and then they're being put out of school because they're finding vapes, and that's a automatic dismissal from the school. So please, all of those things, the backpacks, the headphones, all these things can disguise the vape. So please be careful out there.
And largely unregulated.
100% unregulated by the FDA, which means anything could be in them. And I guarantee you in 5 years, we will have a lot of health issues with the lungs because of all the vaping being done.
All right, parents, pay attention. Dr. Corey Hebert, appreciate you being with us as always. If you missed any of these health topics that we just discussed, you can, of course, find them on our website, wwltv.com. You will also find your other top health stories.